Namaskar. Good afternoon and very happy Sharadiya to all of you. So, I am Dr. Koushik Dutta, consultant neurologist at AMRI Hospital, Dhakuria. And the topic I am going to speak about today is on dengue. So, uh, the proper pronunciation should be dengue, but we usually call it dengue. So, you should be thinking why a neurologist is talking about dengue, because dengue is basically something that you know about causing bleeding and shock syndromes requiring treatment, and many of the patients may have simple fever. Many of the patients may not have any symptom at all, and many patients will continue to suffer with a lot of body ache, joint pains during the fever and even after the fever. But today I'm not going to talk about those body aches and other things. What uh, intrigues me right now is the central nervous system features, the encephalopathy caused by dengue. Within the past 2 weeks, I received 4 patients who presented with first episode of seizures, convulsive seizures, khichuni. They presented with that, and they were unconscious after that. And that was the first episode of such thing in their lives. And with the proper history taking, we could find a little bit of fever was there, even not on the same day in some patients. The fever had subsided in 3 of the patients, and one was continuing to have fever. But they presented with this, and we find that the patient actually has dengue and dengue related encephalopathic changes. So this is an important thing that can happen in dengue. In most of the years of dengue fever that we have encountered in the previous years, we got only a few patients with this dengue encephalitis or dengue encephalopathy syndrome. But this year, somehow, we are getting more patients with encephalopathy in this year's dengue. As we all know, that in patients suffering from dengue, the platelet count, the concentration of the blood that is measured by PCV, these are very important. That is repeatedly tested in the hospital, and the patient is given a lot of fluid, and certain medicines are avoided so that the patient doesn't suffer any sort of bleeding, the platelet doesn't fall any further. And you also know that there is no role of antibiotics in treating dengue. So these things remain common for the patients also who present with dengue encephalitis or encephalopathy syndrome. Now, what causes dengue encephalitis? The thing is, primarily, dengue is not a very neurotropic virus that will frequently cause encephalitis. It's not that type of a virus. Dengue is basically a single-stranded RNA virus. It primarily causes the complications that we know of, but it can cause, apart from the hematological complications and pain in the body, it can also cause liver damage, it can cause damage to various other organs, it can cause multi-organ dysfunction in some patients, and it can cause encephalopathy also. Now, in all sorts of encephalopathy of dengue, there can be various causes. There may be encephalopathy secondary to the liver failure caused by dengue. There can be cerebral edema because of lack of blood perfusion. The patient has suffered a shock syndrome, or the patient has suffered gross reduction in blood pressure without a shock, but that has caused significant long-term reduction in blood flow in the brain, and that can cause edema, hypoxic damages. Those can be responsible for the encephalopathy. But dengue can directly infiltrate the brain and cause encephalitis, that is an inflammation of the brain because of this virus. That is also possible. And dengue encephalitis is like, it will present clinically like any other virus, any other viral encephalitis. Now, in some cases, these seizures and unconsciousness in a patient with dengue can also be due to bleeding inside the brain. You know that dengue patients may bleed from any side of the body if the platelet count has come down too much. Then there may be bleeding inside the brain, which is just like a hemorrhagic stroke that any other patient may suffer. But at the same time, it may cause an encephalitis like the other viruses, prominently herpes simplex and other things. So we need to be just aware of this possibility so that we can tackle it very fast. And as I said earlier, that most of the antibiotics have got no role in treating dengue. Even the commonly used antivirals also are not effective against dengue. So the approach towards treating dengue encephalopathy will be, number one, symptomatic. For example, if the patient is having seizures, we have to treat the seizures. Then the cause of those seizures and unconsciousness. If the patient is having hypoxia, we have to revert it. If the patient is having edema in the brain, we have to treat that edema, reduce the edema. If there is a hemorrhage inside the brain, we have to treat the hemorrhage. Now, if there is an encephalitis just caused by the dengue, if we do an MRI, we will find certain changes that is typical of viral encephalitis, and that will be found in dengue encephalitis also. Normally, in this situation, we want to do a lumbar puncture to do a CSF study, and the CSF study, cerebrospinal fluid, is a watery substance that circulates in the brain and spinal cord. So if we study the CSF for the protein, sugar, chloride, the amount of glucose in it, the cell types and counts in that, and we can study the individual viral RNAs by PCR also. If we can do this, then we can identify whether it's a proper viral encephalitis, or it's a bacterial meningitis, or it's a tubercular meningitis, or a fungal infection, or whatever. And then we can tailor the treatment according to the exact causative agent. But in dengue, sometimes it may so happen that the patient is also having very low platelet count and bleeding from some part of the body. In those cases, doing a lumbar puncture may be very risky, and it has to be delayed a few days. Now, you know that there is, from the findings and from the MRI, you know that there is probably a viral encephalitis, and you don't know exactly which virus is causing it. Then it may be prudent to start an acyclovir, which we start for herpes simplex virus and any undiagnosed viral encephalitis. So we may start it to for the as long as the correct viral diagnosis is not available. And symptomatic management for the patient is very important, making the patient stable and giving all sorts of support. Some patients even may require ventilation. Out of the 4 patients I received in the first 2 weeks with this condition, only one required ventilation, and she also came out of ventilation very fast within 2 days. And fortunately, all 4 of them have recovered. But the important thing is that you keep in mind that this is possible, this can happen. And in this season, when monsoon is ending, viral encephalitis due to various other viruses can also happen, but at the same time, dengue is also causing encephalitis this year. So you just have to be aware of this and just observe the symptoms, go to your doctor very fast, or reach a hospital which has the capability of treating acute neurological patients, and we should start the treatment as early as possible. And till now in this year, the outcome has been good, and I hope it will be good for the patients in future also. So with this, thank you very much, and wish you happy pujas. Have happy days in front of you. Namaskar again.